Well, hey, this is pretty shocking. You would have never known that Sharon Stone suffered a brain hemorrhage about 10 years ago.
Yeah, I don't know if you remember this, but doctors say she is lucky to be alive. Thankfully, she's back on track. She's doing very well. And this is one of the reasons why I sat down with Dr. Matthew Kang, a neurosurgeon at Regents Hospital, in today's Doc Hollywood. Hey everybody, I'm here with Dr. Matthew Kang, and Dr. Kang, you are a neurosurgeon at Regents Hospital. Thanks for being here today.
Thanks for having me. Happy to be here.
Well, we're glad that you're here today because you're going to help explain a few of these celebrity health mishaps to us. Starting with Sharon Stone, she's revealed that she suffered a near-fatal brain hemorrhage. She's lucky to be alive. Can you talk a little bit about what this hemorrhage is and how she recovered?
Absolutely. Sharon had a subarachnoid hemorrhage which occurred in the vertebral artery. There are two arteries that supply your brainstem and the back third of your brain. The subarachnoid hemorrhage occurred because of a tear. Now, about 40% of people with this bleed don't even make it to the hospital and die.
Wow.
So she was lucky to survive that. Treatment-wise, what we do is we use a minimally invasive technique and we put precious metal up there to coil off or block off the vessel that's bleeding. Fortunately for most people, there's two of these vessels, and the remainder can do the job of both.
So how would you know if this was happening to you or someone that you love and you needed to get them to the hospital right away?
The key symptom is the worst headache of your life.
Wow.
And that blood causes that. The other symptoms to look out for are things like light sensitivity, nausea, and vomiting.
How fast do you need to get in to see a doctor?
As soon as possible.
Moving on to Dorothy Hamill, bummer, she had to leave Dancing with the Stars because of a spine injury, and she says she has a cyst on her spine that might not be able to be repaired, and she could suffer some nerve damage. So how do you go about solving that problem?
I love Dancing with the Stars, so it's hard to see her go.
I know.
But these cysts in the spine most commonly occur because of wear and tear in the joints. And these cysts can literally push on the nerve root, causing back pain, buttock pain, and leg pain, as well as weakness and numbness. The major way we treat these is to take the pressure off. So we go into the back through a procedure called a decompression or a laminectomy, and we literally cut these cysts out. We relieve the pressure on the nerve root, and generally the symptoms subside.
Are there situations when you can't go in and fix it?
Sometimes people are born with these pockets which you can try to drain, but they'll reaccumulate, and they generally don't respond to surgery. So that's maybe what she had.
And moving on to actor Larry Miller, who you might not know by name, but he was in Pretty Woman, 10 Things I Hate About You, lots of other shows that we've seen. And it is the one-year anniversary of him falling and hitting his head. He was in a coma for a month. Good news is that he is expected to make a full recovery. So, brain injuries from falls, how common is this?
Much more common than you would think. It's one of the most common conditions we see in the hospital. Sometimes 3 or more patients a week with severe brain injury. Ladders, rooftops, falling from heights is one of the most common mechanisms. Now that it's warming up in the Twin Cities, if you're going to do a project, use a professional. It's very important, try to not do it yourself and hire someone who's trained to do it.
Absolutely. So what happens if you fall and really hit your head hard?
You can have severe injuries to your brain and spine. Sometimes the injuries are irreparable or could lead to paralysis. So the injuries can be very severe.
So it's really just taking those precautions, being careful when you're doing those things.
That's right.
Thanks so much for your time, Dr. Kang.
Thank you for having me. I'm happy to be here.
And you can vote for next week's Doc Hollywood topic. You could win a subscription to People magazine. That'll help keep you up to date with all the celebrity gossip. So here's how you enter. Text Doc1, Doc2, or Doc3 to 42379 for the topic you want to hear about next week. You can choose from Zac Efron's new cast, Kendra Wilkinson's injuries after a weekend car accident, or Splash contestant Nicole Eggert getting hurt after a scary dive. I'm telling you, Megan, there are a lot of celebrity health issues.
Wasn't Nicole Eggert on Charles in Charge?
Totally. Charles in Charge was an amazing show.
I can sing you the theme song. I'll wait for the commercial break
Let's
for that. That's one of those fun things stuck in my head. Thanks to Health Partners Clinics, of course, in Regents Hospital for sponsoring the show. Remember to check out your physician. Talk with your physician if you have any health concerns.
What about Fresh Prince of Bel-Air? Can you do that one?
In West Philadelphia, born and raised on a playground.
Everybody, that's so good. Man, I'm impressed. Still to come.